This virus is absolutely still circulating.
Despite efforts to move on from the pandemic and return community activities back to normal, the province of Manitoba releasing some chilling stats showing an increase to 939 COVID-19 deaths in 2022 compared to 731 in 2021 and 661 in 2020, according to the report from the Government of Canada. Epidemiologist Cynthia Carr says that the data is not surprising based on public perception and changes in behaviors towards how the virus is being dealt with compared to previous years.
Unfortunately, these numbers don't come as a shock to me because the less we talk about things, the less we keep it on our radar, the more likely it is for events to continue to happen, such as continuation of spread.
Carr says that with more mobility and less protective barriers in place, death is more likely to occur among the vulnerable population of Manitobans.
The by far highest percentage of deaths is in our elderly population and those with other health conditions. And again, with the flu season as well, having a serious impact, there's just more opportunity for people just to have kind of a battered immune system right now because we're fighting lots of different viruses, and that's really important for people to keep in mind.
She draws attention to other factors that make people vulnerable.
Have unfortunately more crowded living situation, less income, more obesity. Those people unfortunately are at a higher risk for poor outcomes because again, their bodies are fighting many factors at the same time. And somebody who's in lower income, you might be in a lower paid job, and many of those lower paid jobs are very public facing. And that's where we have to continue to work together in terms of just our overall health status as a society.
She says people should not live in fear, but rather as they go about their daily businesses to be aware of the risks and take protective measures.
You know, we don't want people living in continuing fear and anxiety and lockdown at all. You need to continue to think of those tools to keep yourself as protected as possible while you wish to continue your life. In a more normal way. With that, of course, comes risk. So, keeping up to date on vaccination, wearing masks, avoiding crowded spaces.
In Winnipeg, Temi Olatunde, City News.